So you can't really see that well, but if you can kind of get it in there and gauge it that way if you want to. Otherwise, the external landmarks are the molars line up with about the outer canthus of the eye, and then we want it at the height of the occlusal plane. And when we're aiming, we can use the little lines that are on the PID here. So this one is the one that you want to aim. That's the one that is in line with the central ray. This is what you want to aim between your contacts. And then you want this line here to be at the height of the occlusal plane. All right, so you want that. So if I'm lining this with the outer canthus, say I just line this here, the outer canthus of the eye, then now I'm too high, so I want to kind of bring this down at the height of the occlusal plane. And some of these guys, you got to come down a little bit more, so just kind of go with your patient's arch always. And then the last thing you want to check is that you're in line, that you're covering this full image receptor. So you want to have the PID far enough forward that you're covering this little tab.
Can you move his arm, like, away from his body? Thank you. And then notice, like, when you look at the face of the PID, guys, how she has it parallel to his arch. Do you want to maybe show them that?
Yep, so when we talk about the face, it's this right here. You want this parallel to the arch. Okay, so this is the face right here that you want parallel to the arch. All right, so then you get them right up on there. Say that's about equal distance between the two arches. I'm going to bring this back a little bit because I just want to cover that. I know that's on my anterior portion. And then you take the shot. That's your molar shot. Any questions about the molar at all? Okay. Oh, don't touch your chair.
I'll edit that out.
Right. So then for the premolars we can see a little easier. So we can go ahead and put this tab right on the middle. And these tabs, I don't know. So when you stick this, you see this little line here? That's like the middle of the image receptor. You want to kind of stick it on that line. Well, these are not fun. Sticky, but not fun. Oh, I can't get it on there.
I don't know that they've seen these before, too, so
Weird.
we'll kind of show you how to fold those and stick them on.
Yeah.
They're new and they're plastic. We used to have paper ones.
And I didn't do a good job of sticking that on there.
But you just kind of peel and stick it on.
And then you're going to, what are the criteria for the premolar?
Distal of the canine.
Distal of the canine, and the two premolars hopefully get the mesial of the first molar. So, have it lined up. And now with the premolar, you can kind of put this right up on the premolar like that. See
So
how I have that aim line right here going right through that contact of the premolars?
So if you envision that line, continuing, it should just pass right through the contacts of the maxillary premolars.
Great.
So you have to kind of stand behind. See how she's standing behind it and looking
That's
down that red line?
Over it.
So you can really estimate, and see that you're passing right through the contacts. So she has to have it down like that to aim, and then eventually she'll lift it
And
up.
then I lift it up when I feel like I have it.
So the top red line is at the distal of the canine.
No, the
No,
top.
it's in between your contact that you're trying to image
okay.
to open it up.
Okay.
Yeah.
So basically there's two different things. There's the receptor placement itself, and then there's the aiming, the horizontal aiming. So with the receptor placement, you place it anterior enough so that you get the distal of both the maxillary and mandibular canine. And then once you've got your receptor placed where you want it, now you need to aim, so you have open contacts, and your aiming is done by using that line on the top to tell you the direction of the central ray. So if you can aim that central ray right through the contacts of the maxillary premolars, you should have open contacts.
And then you should be parallel, but just always check anyway, just to make sure that you're parallel. Okay.
And then the face of the PID is always parallel to the teeth that you're taking a picture of. So in this case, we're taking a picture of the premolars. So the face of the PID is parallel to the premolars. When we were doing the molars, the face of the PID was parallel to the molars.
And then if you wanted to use a landmark instead of doing the aim, it'd be the pupil of the eye. But when we say that, we don't want you to come in like this, because what would happen if I did? If I'm pointing this line directly at the pupil of the eye.
Look at the anteriors.
You wouldn't really get anything, right? Because the film isn't.
You might get something, but what would it be? What would be the error if I was like,
Overlap.
yes, it'd be very overlapped if you did like that.
Because your horizontal aim would be off, right?
Yes. So yeah, so that is tabs. And then this one, we have kind of been recycling, so you can kind of use these to go to the next one or whatever. Just stick it on there.